So I'm here today with my friend Jorge Rodriquez. George, thank you for joining us.
You're welcome.
We're here to talk about healthcare. And George is a friend of the family, lives in a neighbor, and he's a family practice physician. And really, we just wanted to have some time to talk about what's going on in medicine from the practice of physicians who are not just practicing as physicians, but also, in a sense, business owners as well, and taking care of employees who are helping them give care to others. And I think that's one voice as we hear more about the government in healthcare and Medicare cutbacks and what healthcare means both to patients and to physicians. The voice of the physician is one that I think doesn't often enough get into the debate. So thank you for coming by, and just tell us a little bit about your background in medicine and practicing.
Absolutely. Well, to give you background, I've been in Cary now since 2003, and after finishing my family practice training, which is 3 years, was in Fayetteville. I did a year of sports medicine training at East Carolina in Greenville, and then I joined a practice here where I was one of the owners for 3 years, and then I moved to a second practice where I was functioning as an owner. And after being in private practice for 5 years, quite frankly, I had to get out of the business because of not making ends meet. I was just keeping the doors open, but I wasn't personally coming home with a paycheck, which is something that obviously you can't stay in business very long.
Wow.
When you don't bring money. And I realize that probably people listening here can't possibly understand or don't understand how a physician is not making any money. And so I'm glad you brought me along so I could maybe enlighten some of the folks on the business of medicine.
Sure. Well, and talk about that. When you set up an office to take care of patients, what's involved? What are the big expenses that take away from your ability to pay your mortgage and put your kids through school and so forth?
Exactly. Well, just like any other business, of course you have the property itself, either the mortgage or the lease, depending on how you do that. Of course, you're paying employee salaries, you're providing benefits, you're providing their health insurance, you're providing their retirement plan. You're also just your medical costs, buying equipment, buying vaccinations, whatever you need to run a practice is all part of what affects your bottom line. And what I saw in private practice was that unless you were, from a primary care perspective, seeing 24 or more people a day, 5 days a week, you were not going to stay in business. And so it's not good for patients. They obviously feel you're running them through the mill, and they may not understand why you can't address all their issues or spend that much time with them. And at the end of the day, that's what it comes down to, just to stay afloat. Insurance companies, since there's so many different ones, the contracts you have with them, they can change them at any time. You pretty much have to be an attorney to understand the fine print. Insurance companies pay you on a percentage of Medicare, and so that's why when Medicare payments go down, which they have, it affects what you make from insurance companies since they're paying a percentage of that. And there's a lot of regulations both from the government side and also from the insurance. We spend a lot of time just trying to get medicines pre-approved, get procedures pre-approved, fighting for very simple things for our patients, which takes up a lot of time, just paying your employees overtime.
Sure.
And I think what people don't realize is there's a big discrepancy in this country between how many primary care specialists, how many care physicians we have, and specialists we have. It's probably about 30% primary care, 70% specialists, whereas in other developed nations it's just the reverse of that.
Mm-hmm.
And the reason comes down to, quite frankly, reimbursement. The insurance companies reimburse more for procedural skills than cognitive skills, and that's where care gets fragmented, as opposed to having a true medical home where you know your patient well and you can take care of them and refer as appropriately. So as far as a business owner, I think the insurance was the worst things that I had to deal with. They hurt me in a couple of different ways. Every year, the premiums go up, so
Right.
They hurt me as a provider in my own family. I have to pay higher premiums every year for me and my family. Then I have to pay higher premiums for my
Your
employees.
Sure.
And then their reimbursement continues to go down, and they find ways to bundle payments, deny payments. When I see a patient, quite frankly, I don't know, one, if I'm going to get paid. You have no idea. Second, if you are going to get paid, you don't know when it's going to be, or what it's going to be. And like any other business, including the dentist or whoever, you can't pass on your cost to your patients. Usually they're contracted fees and that's it. So even though your cost of business goes up every year,
Right.
reimbursements go down. And
that's amazing, and I think so many people don't understand that. When you're an attorney and you have someone that's going to be your client, they sign an engagement letter and they're agreeing to pay a certain hourly rate for the time that they spend with you. Likewise, for any other store, you walk in and you approach the cash register with an expectation that it's going to cost you something. And medicine, especially from the physician side, what you're saying is you may have a patient walk in the door, but you have no idea whether the person is going to pay, how they're covered, if they're covered, and then depending on how they're covered, how long it's going to take you to see the money and what reimbursement you're going to get for what you need to do with them.
That's exactly right. And it's really, no other business can operate that way. And physicians are being expected to practice that way, and that's why so many family docs have actually gone out of business, including myself. I could rattle off a whole list of names of folks that's happened to, and I know the viewers just can't possibly understand how could that be the case, but it is.
So to put it in perspective, so you said you needed to see 24 patients per day.
120 a week.
120 a week at standard reimbursement rates for an outpatient visit.
Right.
To do what? To break even?
To basically break even. Exactly.
Okay. So that means like 20 minutes per patient.
And most of our appointments are scheduled at 15 minutes, but that what people don't understand is not 15 minutes in the room. That includes by the time they get in the room, I see them, I write their prescription, do whatever, and on to the next patient. So you're really FaceTime with the patient maybe 7 minutes.
Okay, and now and just to put that in perspective, so to spend 20 minutes with a patient for one provider, so you as a single provider spending 20 minutes with the patient to see 120 of them per week, how many other folks are required just to keep that machine running in terms of talking with the insurance companies, following up on benefits and claims?
And that's an excellent point. This is where your overhead gets impacted. You always have to have an office manager. You really should have an office manager. You have at least one front office person per provider to make the appointments, check in and check out. You usually have one medical assistant per provider, and usually have one extra one to do some of the extra float work. And then on top of that, you have usually a referral coordinator. You're paying full time just to sit there and coordinate referrals, and that's stuff that you're not receiving any money for. It's all being done on the back end for free. And then of course you usually have to outsource your billing, and most billing companies is an 8% billing fee from the top basically. So those are all things that it just dramatically impacts you. And I think for our folks out there to understand, I made a point, the physicians are all reimbursed differently. They're called relative value units, and to make a long story short, a cardiologist per se would only need to do 5 angioplasties to receive the same compensation that a family doctor would need in 84 patients. So that's how
84 patients.
Right, to 5 procedures. And so the specialists still are, because of the way they're reimbursed, aren't quite as squeezed as the general medical guys are.
Right, and I certainly saw that myself in training, in the sense that the subspecialists and the specialists who are billing based upon procedure codes,
Right.
they have a better idea of how they're going to be able to make ends meet, just because the reimbursement is so skewed in that direction. And so tell me what happened. How long did it take? You said you were in practice for 5 years, in private practice for 5 years, before you gradually decided to get out of that business. What changed over those 5 years? Did the lines actually cross where all of a sudden income and expense didn't meet anymore, and what were the factors that made that happen?
No, exactly right. That no matter how many patients a day I was seeing, no matter what I was doing, it no longer, the income could not keep up anymore. So basically I could just pay my employees, pay my overhead, but not come home with any money. And it was unsustainable. And unfortunately, if it was just me that it happened to, okay, you could argue he's a poor doctor, poor business